First of all, we have to say to everybody that this webinar is recorded for the minutes, for the purposes of the minutes and nothing else.
Katie, I think please be reminded that this webinar will be recorded for later dissemination purposes.
Yes.
Yeah.
The floor is yours, Joyce.
Thank you. Hello and good afternoon. Welcome to this Sjogren'S Europe webinar about dry mouth and saliva. I just saw participants from the USA, Ecuador, Canada, so not just Europe. This is a webinar organized by patients and for patients and anyone interested in Sjogren'S. My name is Joyce Koelewijn-Tucker and I'm a member of the Sjogren'S Europe board. Thank you so much for your interest and attending this webinar. We hope you find it informative and interesting. Please be reminded that this webinar will be recorded for later dissemination purposes. We warmly thank and welcome our speaker, Henk Brandt from the Netherlands, for offering his time and expertise. I also would like to express a special thank you to Sjogren'S Europe board member Katie and her team for the technical support, and to my fellow board members Alice, Anna, Coralie, Linda and Marcia. This webinar was organized with the help of unrestricted grants of Servier, Norgine and Novartis. Thanks to them for their trust and support. Sjogren'S Europe strictly follows the EFPIA code of conduct between the pharma industry and patient organizations. Sjogren'S Europe and the content of the webinar are totally independent from these companies. After the presentation, we have a question and answer session led by my good friend Ana Vieira, also board member of Sjogren'S Europe. If you have any questions, please write it in the dedicated question box. The chat box is for comments only. This webinar is for the benefit of Sjogren's patients and their carers. To ensure that questions of Sjogren's patients or their carers can be answered first, we kindly ask that industry colleagues in the audience refrain from asking questions in the Q&A session. Finally, let me now start with introducing our speaker, Dr. Henk Brandt. Henk Brandt is a medical biologist and associate professor at the academic Center of Dentistry, Amsterdam, the Netherlands, where he works at the Department of Oral Biochemistry. His research is mainly focused on investigating the protective effects of saliva, causes of oral dryness, and the relation between changes in saliva and systemic diseases. During his studies, he frequently collaborates with the National Sjogren's Patient Association of the Netherlands, and he has written almost 200 scientific publications about his studies. During the webinar, he will focus on causes of oral dryness and difficulties in developing properly functioning saliva substitutes. Henk, the floor is yours.
Thank you very much, Joyce, for these kind words. And I am very honored by the invitation of Sjogren'S Europe to give a presentation. So I'll now try to share my screen. And yeah, I hope you all can see it. Pointer options. This one. So indeed, the main topic is why it's so difficult to prepare a real good artificial saliva. And so I think now everything is ready. As Joyce already said, I work at the Academic Center of Dentistry in Amsterdam, which is short abbreviated ACTA, and is located here near in the inner city at the campus of the Vrije Universiteit Amsterdam. When we are born, we are almost all we have sufficient saliva. And saliva is essential for the maintenance of the oral health. And you can really see that this young boy, he really enjoys the saliva, he's smiling, he's even drooling. And he's not aware that there are people that later in life will have a lack of saliva. Saliva is, as you probably will know, mainly derived from 3 pairs of salivary glands. Here you have the parotid gland, located in front of the ear. Then you have the submandibular gland, here in the back of the jaw, and then more in front of the jaw, you have the sublingual gland under the tongue. And together with some minor salivary glands and the lips and the palate, they produce saliva. A limited amount during the night, because you don't want to drool on your pillow, and more during the day when you're eating, speaking, and you have other activities that urge the need for saliva. Saliva has many important functions. Here you see just a handful of them. A major issue is that saliva protects the oral mucosa from drying out. And by doing that, it also reduces the risk of damage to the oral mucosa. And of course, it reduces the risk that you suffer from a dry mouth feeling. But it does much more. Saliva binds bacteria. It has ingredients that bind bacteria, and because they bind to those components of saliva, the bacteria will not adhere to the intraoral surfaces. The bound bacteria will be swallowed, transferred to the stomach, and there, in the acidic environment of the stomach, they will be killed. In addition, saliva also contains ingredients that directly kill bacteria and fungi, and thereby also they are not able to adhere to the oral cavity surfaces and create infections. The proteins in saliva produce a small layer of proteins on your teeth, and that has several functions. That layer of proteins reduces the risk that bacteria will adhere to your teeth. And it also gives a protective layer that reduces the risk of damage to your teeth during normal daily activities, while chewing, clenching, etc. And finally, if small wounds arise in the oral cavity, your saliva has all kinds of ingredients that enhance wound healing of the mucosa. So wound healing in your oral cavity is much more faster. Unfortunately, in life, there can be a reduced amount of saliva secreted, causing a lack of saliva. And in most patients, the most widely cause of lack of saliva is use of specific medication that reduces the secretion rate or combinations of saliva. In this case, however, the salivary glands themselves are not damaged. So after you discontinue the use of the medication, the saliva secretion will normally return to normal. And of course, that's not always possible, but sometimes it's possible to switch from one medication, which gives severe oral dryness, to a similar medication, which has this negative effect less or even not at all. Or sometimes your physician can change the dose, which is the cause of the medication of dryness. Another cause of oral dryness is radiotherapy of the head and neck area. People with tumors in the oral cavity often receive radiotherapy, and radiotherapy not only destroys the tumor cells, but despite the improvements in radiotherapy, it will also still damage healthy cells surrounding the tumor. And often salivary glands are in the vicinity of the tumor. So they will receive radiotherapy, and part of the salivary glands, some of the salivary glands, might be destroyed. That's irreversible, in contrast to the cause of medication-induced lack of saliva. And the damaged cells will be replaced by connective tissue. Connective tissue can't produce saliva, and you will have less saliva than in normal conditions. And I assume that almost you are Sjogren's syndrome patients or relatives of patients with Sjogren's syndrome disease. And in Sjogren's syndrome, there's an autoimmune disease that destroys your salivary glands and replaces them also with connective tissue. So also here you have a gradual but irreversible process which destroys salivary gland cells and leads to a reduction in saliva secretion rate. And finally, of course, there are other causes. I mean, chronic stress, for example, and currently I now have a little bit of stress because I have to give a presentation in what's not my native language. So I suffer from acute stress, but that will be over, I hope, in 1 hour or so. You, as a patient with Sjogren's disease, you are suffering from an overactive immune system. Your immune system is something wonderful. Your immune system is there to discriminate between intruders that have to be destroyed and your own cells of your own body that should not be attacked. And unfortunately, in your case, the discrimination between these two types of cells gets wrong. In some cases, normal body cells are destroyed by your own immune system because they think there are intruders. And in your case, that's gland cells. And not only gland cells in the salivary glands in the oral cavity, of course, but also gland cells here above the eyes and in other glands. Here's your typical Sjogren syndrome patient, 62 years old. And obvious from this picture is that she suffers from inflamed eyes because lack of tears. What's less obvious from this picture is that she also has inflamed corners of the mouth. And when she would open her mouth, you might see indications of the dry mouth. And we asked this lady to drool into a plastic tube so we could measure the secretion rate of the saliva. And it was far, far below normal values, almost nothing. What are you doing when you're suffering from a dry mouth? Well, I think this is an experience many of you will have, that if you take a sip of water, it will not really help. It gives only for a few seconds relief, and then it's gone already. So you don't have a long-lasting relief of the oral dryness feeling. And that's because there's something missing. Water is not the perfect solution to wet the oral cavity. And this complicated slide summarizes the functions of saliva again. So here you have the antifungal, antibacterial, antiviral functions of saliva, killing of bacteria, fungi, viruses. They help with coating and lubrication, to start the food digestion. They help to mineralize teeth, providing a buffer against acids that come into your cavity by drinking or eating acidic things, and enhancing wound healing. And the small print around here are indicated dozens, and it's even not complete, there are even more. Here are the dozens of ingredients that help saliva doing all these functions. And if you're drinking a bit of water, you will not have a fluid with all this remarkable stuff. And one of those ingredients is especially important for the maintenance of all wet feeling. That is this molecule. The slide may not be too clear yet at the moment, but please believe me, these mucins are enormous molecules present in your saliva. These molecules are actually so large that you can see them on an electric microscope, which is remarkable because usually molecules are very small. And when we study these enormous molecules and look into them in more detail, you will see that they have all kinds of areas with lots of side chains. And these side chains are composed of sugar residues. And I won't bother you too much with biochemistry, but these side chains are important because these side chains are negatively charged. And therefore, water can bind to the side chains. So water is no longer free floating in the oral cavity. The water binds to the mucins. And that's why in saliva, which contains mucins, water will remain in the oral cavity for much longer because it can bind to the mucins. And then you get this situation. This picture may look a little bit complicated, but have a look in more detail. These kind of gray stepping stones These are supposed to be the epithelial cells that cover the oral cavity. Below here, you have the lower tissues like muscles, etc. And on top of the epithelial cells, here you have those mucin molecules. I make a kind of green-blue threads. Keep water. So what you actually get is a thick mucus, a kind of viscous layer on top of the epithelial cells that prevents them from drying out. And they keep the water and keep it in the area near your epithelial cells. And this thick layer has additional advantages because this is the oral cavity and the wart area on top of it. And bacteria present in the oral cavity will have difficulties penetrating this thick mucus layer. So they can't reach the epithelial cells and can't reach the underlying layers. That's protection. This thick layer also gives protection against acids. Acids are illustrated here by the H+, the symbol we use in biochemistry for protons, and it also gives protection. So it's important that you have such a natural thickening agent to keep the water into your mouth and to keep a moist feeling for a long time. Well, what can you do if you don't have enough saliva? Well, first thing you can do is you try to stimulate your own saliva. And you can use different techniques for that, like chewing, taste, and chili melts. Well, taste. Taste is a very strong stimulus for saliva secretion rate, and the most strong stimulus is acid. If you add some citric acid in form of candy, etc., you will immediately usually feel the parotid gland trying to produce saliva. Even in your case, I mean, most of you will still have some saliva secretion, and you can. However, I have to warn you that bringing acid into the oral cavity also has risk if you still have your own teeth. Because acid is detrimental to the enamel of your teeth. So acid is a great stimulus if you have a full prosthesis, but please be restrictive in the use of this stimulus for saliva if you still have your own dentition. Sweets can also enhance saliva secretion rate, and menthol is also a stimulus for saliva. However, during my many conversations over the past, now I think George will think we know each other for about 15 years now, I've spoken to many members of the Dutch Patient Federation. They often indicate that even a tiny amount of menthol is often too much. And so it should be very carefully dosed, not too much, because otherwise it's not appreciated. Other options, if you still have the capacity to stimulate your own saliva, you can use a combination of taste and mechanical stimulation by using chewing gum. You see some possible brands, and I don't have any commercial interest in any of the pictures I show you. And you can also use some vegetables, for example, pieces of carrots or cucumber, and cucumber has the additional advantage that it has a high content of water in itself. This is another interesting development. I'm not sure if they're available in all the European countries in the American, USA, Canada, or Ecuador, where you live, but these are called chili melts. These are small discs, let's say about 6-7 millimeters in diameter. And these discs are supposed to be placed on the oral mucosa, from back in your oral cavity. And these chili melts contain several ingredients. First of all, they contain menthol. And the idea is that you usually place them just before you go to sleep. The menthol will slowly dissolve from the disc into the oral cavity, stimulate your saliva secretion rate, and thereby reduce the oral dryness feeling. It contains also xylitol. Xylitol is a sugar substitute. You don't get caries from using xylitol. And xylitol in itself also has some saliva secretion stimulating effect. And finally, it contains cellulose. And cellulose is in it because it's a molecule that a little bit resembles the mucins that I've presented to you before. So the cellulose is there, that the water, the saliva that's produced by these ingredients, menthol, xylitol, remains longer in the oral cavity because it will bind to the cellulose that also come out of the disc. I have to be honest, as far as I know, I mean, the scientific evidence for this product is very limited. I'm only aware of one scientific publication that has explored the effect of Sjogren'S, and they not only included patients with Sjogren's syndrome, but they also included patients with other causes of dry mouth, and they found some positive effects. However, I've spoken to several patients that report beneficial effects from them. So at least you can try if it would be useful for you. Well, another option is, of course, that you can ask your physician for a medication, pilocarpine. Pilocarpine is a medication that stimulates the saliva secretion rate. However, it not only stimulates the salivary glands, it also stimulates other glands. And due to that, many patients will experience sweating in their hands, in the inner sides of their hands, in their armpits, etc. So for quite a few people, that's a reason to discontinue the use of pilocarpine, because these unwanted side effects are so unpleasant that they don't want to use the product anymore. So, and finally, if you have no longer the capacity to stimulate your own saliva, then you can only go to artificial saliva. But before I go to that, I want to mention two other interesting, more or less futuristic options. The first of all is stem cell transplantation. That's not available for humans at the moment, but it's experimental in animals, that you try to reseed the damaged salivary glands by providing new, fresh salivary gland cells, thereby restoring the original cells. And the other is irrigation of the salivary glands. In the irrigation of the salivary gland, what's done here by my colleagues from the academic hospital is that a very small endoscope, this is a diameter of approximately 1 millimeter, is introduced into the duct of the salivary gland. And with a saline solution, the ducts and part of the salivary gland are flushed. This removes debris from the duct and the gland, and at least restores the capacity that's still left. Optimization of that, and it improves the saliva secretion rate we have demonstrated for up to 12 months. And this is the view that the oral surgeon has through the endoscope. If you find this interesting, you should ask my colleague who works on this project to give a presentation on this in more detail in the future. But let's go to the artificial saliva. There are many, many artificial salivas available. This is just a handful that I came across during the many years that I've been doing research in this area. And again, I don't have any interest in any of these. Here you see other brands. Maybe some of them are familiar, some of it not. There are, I think, even much more available. Well, what should the ideal artificial saliva look like? Well, we have seen that's important that any fluid that is produced or brought into the oral cavity should remain there for a long time and needs a thickening agent. Needs something like the mucins that does that job in normal saliva. So that should be it. Second, there should be a kind of buffering system. A buffering system that keeps the acidity, the pH in your oral cavity around neutral. That's also present in normal saliva. So if you bring in some acidic into the oral cavity, then it should be buffered, it should be neutralized. Finally, I've shown you that there are many, many antibacterial components present in normal saliva. And it would be great if there at least would be a few of them added to your artificial saliva. So they could help killing any bacteria that come into the oral cavity. Yeah, because you buy your artificial saliva, you would keep it in your bathroom on the shelf for some time. We certainly would need some kind of preservative to prevent that bacteria will grow into the bottle with spray or whatsoever. And finally, we could think about some flavoring. And if I ask you, what's the taste of saliva? Then you probably will say, saliva doesn't have a taste. And if I ask you what's the taste of water, you also probably say, water doesn't taste at all. But if you ask people if they could discriminate between water and saliva, I think most people can discriminate between those two fluids. So maybe it's not the taste as such, but more the perception, the experience of the project. So at least the artificial saliva should have the same experience, the same taste that you have as saliva has. Well, let's see where we can find some source of thickening agent. On the right side, you here see the cellulose that was present in the chili melts, and the cellulose is derived from industry. It's very easy because cellulose, it's also used in the paper industry because it's used to produce paper in all kinds of form. So it's very easy to produce, but these molecules are not that large. They are not that enormous as normal mucins in the oral cavity. So saliva substitutes based on cellulose usually don't work too well. Well, do we have a second option? Yes, we have. We have the so-called Xanthan Gum. That's also derived from plants. You see the leaves from Xanthomonas campestris. And you can isolate Xanthan Gum from these leaves, and it's widely used in the food industry. Here in the Netherlands, we are very fond of licorice, and Xanthan Gum is usually used in licorice. I don't know if they use licorice in other countries. I think it's less popular there. But also in desserts, etc., it's widely used. So it's safe, it can be used. And indeed, xanthan-based gums, xanthan gum-based artificial salivas are usually working better than the ones based on cellulose. So this a little bit more resembles the natural mucin. So then we finally have the option, yes, it's possible to purify mucins that resemble the mucins we found in the oral cavity. That's if you go to the slaughterhouse and you isolate them from pig's stomach. But yes, you can imagine that for quite a few people, the use of a product derived from pigs is not acceptable because all kinds of lifestyle reasons, religious reasons, people being vegetarian. So for many people, it's not useful. However, I have to admit that from a biochemical point of view, these mucins resemble the ones in your own oral cavity the best, and theoretically should also be the best to be used in artificial saliva. Well, we once went to one of the annual meetings of the Dutch Patient Federation, and we asked people about their experiences with mouth sprays. And to be honest, these were rather disappointing. I think we interviewed about 100 of the patients that visited this annual meeting, and we asked them, have you ever used a mouth spray? Are you still using it? And if you don't use it anymore, what was the reason why you discontinued the use? And by far, the most important reason was that people said, I've stopped using it because it was not effective. Many even said, it's just as effective as drinking water, and drinking water is cheaper. So yeah, that didn't really work. Another complaint is that people didn't like the taste of the artificial saliva. And I mean, I'm not a patient with Sjogren's disease, but here at the lab, we have tested several of these products our own, and indeed some taste awful. We still have, if I ask my colleagues, they still can remember the awful brown stuff. I will not tell you which awful brand that was, but it was horrible. So taste is a major issue if you have to use products over a long time. And finally, there were other reasons, and the other reasons was that people found the spray bottle poorly designed, so they find it difficult to apply, or the tube with the gel was difficult to open, that kind of reasons. Well, we decided here at our lab that it was time for innovation, and that a new artificial saliva should be developed. We did it in collaboration, not on our own. We, from the Academic Center for Dentistry Amsterdam, I think we have knowledge about saliva, lack of saliva, as Joyce told during the introduction. So we joined with Wageningen University, that's also here in the Netherlands, and there are experts on food technology, taste, etc. We had some industrial partners that provided ingredients. Of course, we were very happy with the collaboration with the Dutch Sjogren'S Patient Federation for their inputs with the design of the study, and later on also with the recruitment of volunteers. And you can only do research if you have money, so we were very happy with the generous grant from the Dutch Ministry of Economic Affairs. And step one is, we thought about, can we look for something different from the pig stomach mucins? Not only because many people are objected, but even if you are, there's one product that uses these mucins on a commercial base, and many people that use this artificial saliva spray with pig stomach mucins complain, at least they experience a rather weird taste. So the taste in itself is also a problem. Then lucky enough, one of my colleagues, it's not my own invention, I admit, so one of my colleagues here on this on the 12th floor, he said, well, in chicken eggs you have a similar product that looks like mucin. It's called Overactive, and it's very strongly resembles human mucins and these other mucins. So first, what we started is collaboration with a company with that industry that's specialized in eggs products, and we isolated mucins from eggs. Now that's more easily said than done. So I think it took us about 2 years. We finally could purify this ingredient on a large scale and keep it into solution. There were some major technical problems that we have to overcome. Well, as I've shown you from previous slides, yes, Joyce, indeed, it's a picture of you, is that we found that taste is an important issue for people that have to use artificial saliva from a long time. So what we did is we had a survey among the Sjogren'S patients and asked them for which ingredients do you object against if you want to use a new artificial saliva, what kind of taste do you want, what's your preference? Then using that information, we went to a company in the southern part of the Netherlands that specialized in taste ingredients for the food industry. This is a really major company. They also work for large-scale food products, for example, the soft drink department of the Heineken company. So they really have a knowledge about how to mask unpleasant ingredients and to optimize taste of products. So here we had several sessions. Well, there were more or less, we also have Masha, is that are kind of wine tasting sessions in which you have different combinations. Because I have to admit that even our own mucin has a bit of its weird taste, and we added different kind of taste ingredients, different flavors, trying to optimize the taste of the product. So, well, of course, you also have to get approval of the Medical Ethical Committee before you can test these new artificial salivas on humans. And now this is a little bit exaggerated, but please believe me, it took me 9 months, and finally, the final report we had to turn in was more than 200 pages, in which we have to prove that all our ingredients, how we purify them and how we make sure that we sterilize them, that we tested the products, that you could keep it on the shelf in your bathroom for 6 months without bacterial overgrowth, that all other ingredients were safe to use, that all the questionnaires, etc., we wanted to ask to the patient were approved. It's a horrible way of work. And then we were ready to roll. We had calculated that we needed 35 patients with Sjogren's disease to test our product. And each of these patients got 2 boxes. First, they got 1 box with a large number of bottles, so it was more than enough than they ever wanted to use. And they got 1 box with enough for 2 weeks of the new mouth spray, or they got a box with spray bottles for 2 weeks placebo. And after 2 weeks, they came again to our lab and then they got the other box. So everyone tested 1 product for 2 weeks and the other also for 2 weeks. The patient didn't know which products they were using in the first or the second period. And I, as a researcher, also was not aware of that. So that was a very exciting time when we started with that. And then, unfortunately, the coronavirus arrived. And the coronavirus really made our logistics a nightmare because at the time we were no longer able to host the participating patients here at ACTA. We closed down for several months. So it became rather complicated. Lucky enough, I could, with the help again of the very cooperative Sjogren's patients from the Netherlands, help complete a major part of the study because we still could ask all the questionnaires by doing it online. And I was sending the new bottles and as a kind of post order office, sending them to home addresses of people, and people would send them back to me. Again, a logistic nightmare, but at least we had almost all the data we wanted to have. And then finally, the exciting moment comes. Once you have completed collecting all the data, then you get the clue and the codes, which patient used the placebo first and which patient used the product first. So you are able to compare the data. And I will not bother you with the 80 tables that we produced in the final report, but this is the outcome. The new mouth spray was hardly better than placebo. Despite all our efforts to produce a product, not too unpleasant taste, the taste was still a problem. And the effects on oral dryness were hardly better than placebo. I mean, the improvements were so little that our industrial partners didn't find it commercially interesting to produce the product as we had tested. So you can imagine that I felt myself a little bit like this emoticon, working 5 years with colleagues so intensely on producing a new product that is, well, that's hard. But we will not give up. We will continue our research on saliva, please believe. So that gave to the conclusion as we published in the journal of the Dutch patient, the Dutch Sjogren's Patient Federation. You can't probably read Dutch, but in English it says saliva substitutes, there's still room for improvement. And I think that's a very nice conclusion of the results so far, and probably also of your experiences. Well, with this, I hope I have, I tried to share our experiences with regard to artificial saliva, the problems encountered in developing such a product. I really, again, would thank you for the opportunity to give the presentation, the opportunity provided by Sjogren's Europe. If you have any questions, well, you always can contact me later. Here is my email address. I hope I didn't confuse you too much, as this nice young gentleman looks a bit confused. Actually, that's my son. Hey, he even has a bottle. Maybe he also had to dry him out at the moment. But I hope you find this presentation interesting, and I will try to answer any question that you may have in the question and answer box in the meantime.
Dr. Brandt, Thank you so much for this very detailed overview and the opportunity for us to understand that clinical trial to bring a new saliva substitute is really a hard job. I don't see yet questions in the Q&A box, but I would like.
Anna, there
Yes,
is
Katy?
there is one comment from Fran Chevalier. I have been using xylamelts for a few months at night and feel they help me sleep better. I don't know if, what is xylamate?
The xylimelts. The xylimelts are those intraoral discs that I mentioned.
Okay.
Anyway, I would like to ask you, considering that this trial you've made was not didn't reach the expected results, what are your plans ahead? Are you trying to isolate mucins from a different source? What are your plans now?
No. Actually, we currently have a PhD student working on another project, and that's a natural product. It's derived from tree, and we think that this natural product is capable, if you use it as a kind of chewing model, to give a long-lasting stimulation of saliva secretion rate. So that's more aimed at people that still have at least a certain capacity to produce saliva on their own. So that's why we're currently working on that. And in addition, our studies on the irrigation with the endoscope that are performed with actually they're clinically performed by my colleague Dirk-Jan Jager, and I'm honored to participate in the project. We continue on that, and what we try to do is now to follow. We have evidence that the average patient has beneficial effects of that for at least 12 months, and we are now asking people if they want to return later on still to see if we even the effect will remain longer. So that's what the main research interest with regard to, I think, dry mouth is what we're doing at the moment. Yeah.
Okay, thank you. There's a question here about clinical trials, but for stem cell use for dry mouth. Do you have any information on this that you could share?
Even kijken. It's one of the question in the question and answer, or there's something.
No, it's in the chat box.
It's in the chat box.
Yeah.
The stem cell transplantation is a problem because the risk is that the newly seeded cells are also attacked. So that's where the main problem is. How are you make sure that you don't get into the same situation as before? I mean, your salivary glands are damaged because your immune system has attacked these salivary gland cells. So you should only make sure, if you introduce new fresh cells to reseed it, if you are convinced that these new ones are also not attacked by the same immune system. So that's I think where the main problem sits with transferring this therapy towards the patient.
Okay, thank you. Another question here on the Q&A box is, should quality of saliva be the test method rather than measuring how much saliva patient have as a diagnosis criteria?
I think that's a very good question, because it's obvious that it's not only how much saliva you have, but also what's in saliva. So this question also connects. So yes, that's also why if you are still able to enhance the own saliva secretion, even if to a limited extent. So let's say 50% of your salivary gland is damaged, then if you still can stimulate the remaining cells, you will have more saliva. And it's your own saliva, not only more volume, but also with natural ingredients. So the quality of saliva is important. Yeah, so what we do here, we have a saliva clinic with people with saliva-related problems can visit, and many of patients that visit the clinic are indeed people with Sjogren's disease or suspected of having Sjogren's disease. And we not only measure the volume of saliva, but indeed we now have introduced that we standard measure the concentration of mucins in it, because as I've tried to explain, the mucins are so important for the dry mouth feeling. Yeah.
Another question is, there's someone in the audience that's sharing that she or he, I don't know, 5 milligrams of pilocarpine 3 times a day. And she still experiences a dry mouth sensation, although her dentist tells her that she's swimming in saliva, that's the expression. Why would I still experience a dry mouth sensation?
Exactly. Again, back to this issue that indeed it has been shown that the amount of saliva, if this attendee has produces due to pilocarpine a very watery, then it will also not remain in the oral cavity. So if I assume she or he produces saliva without the normal concentration of mucins, then the saliva will not remain in the oral cavity like the sip of water in a similar situation. So that might be an explanation for this experience. And it would be very interesting for this attendee to have analyzed the concentration, the composition of saliva that's produced under these conditions. So you can't measure mucins everywhere. If it's a attendee from the Netherlands, then she should contact us and we can do it for her. If it's an attendee in the UK, she might contact our colleagues at the London Salivary Research Group. They can also do it over there. But I think you might try to find the answer for this experience in that approach. Yes.
Okay. Another question is, are there any news about Sjogren's root cause to address actual reasons of salivary blockage, not only addressing treating symptoms with artificial products, which are challenging, as we have seen, as well as to develop? The root causes are always the big challenge.
That's not my real area of expertise. The contribution that we try to do in this area, we try to develop tools that help dentists and physicians to identify, to diagnose Sjogren's at an early stage. Because this participant indicates, it's of paramount importance that you try to diagnose Sjogren's at an early stage. And what I hear from many patients is that, especially in the past, it's getting better. It took often years and years and years after the initial complaint before they were finally diagnosed with Sjogren's syndrome, and then you can use appropriate treatment. So if you are able to diagnose Sjogren's syndrome at an early stage, then I can imagine that people can receive immune suppressive therapies using biologicals that are very specifically interfering with this autoimmune reaction, and thereby try to either stop or at least delay, slow down the degradation of the salivary glands. And I think that's this question about.
Thank you so much. Back to one of the topics of your presentation, there's a question here about the irrigation of the salivary glands. And the question is this method available currently as a treatment anywhere, or it's just at research stage?
Yes, it's available at some centers. I think we are the very first center that initially there were a few reports that did this technique on individual patients. In scientific literature, these are called case reports, without real scientific evidence. So our collaboration is one of the very first trying to give really scientific evidence. There are a few groups, not only here in the Netherlands. Here in the Netherlands, it's done not only here, but also at a center in the northern part of the Netherlands. And there are a few other oral surgeons elsewhere that perform this technique. Yes, it's not widely available, but there are a few surgeons oral surgeons that offer this technique.
Okay, and is there anything you can use if you have problems to eat food that is a little bit spicy? Because you get that burning mouth sensation when you have dry mouth.
Yeah, yeah. I think that's a real problem, because indeed tasty food is important for all of us, because it gives you a better pleasant feeling. Normally well-prepared food might optimize your saliva secretion rate when you're eating, and then saliva is important to be able to swallowing. However, yes, at the same time, I can imagine that you want to limit the use of spices in your food, because otherwise they are very unpleasant for your vulnerable oral mucosa. Yeah, so that's a bit of a problem. Interesting question. I think it would be. The funny thing is, yesterday I was at this very same time I was having a online meeting, which is about trying to develop specially tailored food for people, for cancer survivors. And they also have very unpleasant oral experiences. And there it's really trying to identify their preferences, and that especially educated cooks give special recipes to optimize the food that they can prepare. I think it would be very good if similar initiatives would be developed indeed for patients with Sjogren'S syndrome. Yes, but unfortunately, yeah, I can't really a real answer to that. But yeah.
Thank you. Anyway, is there a way of measuring the percentage of salivary glands which are damaged? Is another question.
I think this is indirectly done by having a saliva secretion rate test. What you can do is in a saliva center, even a little bit in a clinic with some interest and that have some equipment, you can measure the volume of saliva produced per minute. And what we do here is we first have unstimulated saliva, and then people are using a tasteless chewing gum. So we have chewing stimulated saliva. And what you can see is you have normal values. What's the average of healthy people that are not suffering from Sjogren'S syndrome? And you can estimate the percentage of saliva that's produced. And the percentage of saliva is more or less related to the damage of the gland.
Okay. Another question is, someone in the audience asks, and I think this happens to a lot of Sjogren'S patients, saliva gets really thick and mucus while we are sleeping in bed, and as a result, we wake up coughing, like we can't just breathe. Any suggestions for this?
No, that's the remarkable thing, that in that case you see that mucins are still secreted, and that's because there are mucins, but there is less water, and that's you get a too thick mucus layer, which gives these problems. I think I've heard that in some cases, mouthwashes with ingredients the same as you have in those coughing drinks that you get might, how's that ingredient called? At least people that cough, they also have sometimes to swallow such a coughing drink. And the same ingredient can be used as a mouthwash, and that will destroy the chemical interaction between the mucins and make them a little bit more loose. The problem, however, is during the night, that still remains a problem. So yeah, I mean, it's still be used. I should look it up. And you can use it before you go to sleep, but yeah, indeed, while you're sleeping, it might still be a problem. Yeah.
Okay, thank you. Another question is the lack of saliva, can it give you a false negative PCR test for COVID?
No. Well, because if you collect a swab with in the nose, but even if your throat, you will still pick up COVID virus particles. Yeah.
And I can share my own experience. I've had COVID recently, and I have extreme dryness, and the PCR came back positive, so no doubt.
Yeah. Thank you for sharing these experiences.
Another comment here and question is, sugar seems to increase mucosal swelling. Why is it this?
I don't know. I have no idea, honestly. It's
okay. There is a question here about the irrigation of the parotid glands. So they are asking if this method, the irrigation, is the same thing as the salinoscopy.
Exactly. The salinoscopy is the scientific name for this irrigation.
Okay. Also, another question. Someone who has type 2 diabetes and is asking if the chewing gum with xylitol is okay for Sjogren'S patients with diabetes type 2.
Yes, xylitol chewing gum cannot be fermented, so it cannot be changed into sugar degradation products. So it has absolutely no effect on your blood sugar level. No.
Thank you so much. So I guess I haven't missed any question.
Well, the final question, I see a question here, Q&A, is the test persons. Yes, the test persons were indeed people suffering a long time from Sjogren's disease, and yeah.
Okay. Another last question. Many dental products are mint flavored. However, the mint flavor causes coughing for some people, which limits the dry mouth options. So
yeah, I think this remark by Mrs. Fisher underlines what I said before, that you have to be very careful use menthol in mint flavored, using mint as a flavor in products, especially for you, patients with Sjogren's syndrome. Yes. Implants.
Yes, a question on implants for Sjogren's patients. Which are the most recommended? And associated problems.
It's possible to use implants in patients with Sjogren's syndrome. There is no contraindication as such. So as long as you have enough bone, you should have enough bone to place the implants in, of course. But if you have enough bone, it's just normal. Well, actually, we're just submitting a paper in which we have a clinical study done in a group patients with Sjogren's syndrome and a group without. and we don't see any differences in the survival of the implants and how they behave. So yes, it's normally possible to have implants as long as your bone allows it.
Okay, thank you so much. Another question is if I think it's related with the lack of saliva. Is there a relation between the dry mouth and the gastric problems, gastrointestinal problems in Sjogren?
No idea. I'm sorry. No, it's the point is that people with Sjogren's syndrome have a higher risk of any other autoimmune disease. The fact that your immune system gets confused between intruders and your own the cells of your own body means that not only they often make mistakes with regard to the salivary gland cells, but they quite often do that also in other organs. So what you see is that patients with Sjogren's syndrome have a higher risk that they also have rheumatoid arthritis, primary biliary cirrhosis, or type 1 diabetes. All other diseases that also have are related to autoimmune diseases. So I'm not completely aware of the specific gastric problems in Sjogren's syndrome, but I can imagine that part of this has also been related with that. Yeah.
Okay, let me have a look. Just a comment on the PCR test that we referred back. It seems that the Sjogren person in the group was the only with the negative test, so maybe less of saliva on that moment. Well, I don't think. I think we've answered this, so it's hard to relate lack of saliva with negative tests.
It's still possible to test the bacteria. Yeah. So the COVID virus, yes.
On the chat box, there's a mention to uveitis, but that's dry eyes, and eyes is not Dr. Brandt's specialty, so I don't think he is able to answer this. The
What's
dry eyes? Can dry eyes cause uveitis in Sjogren's patients?
I assume that, yes, but I'm not a specialist, but yes, so I assume yes. But please ask a specialist on eyes.
Yes, maybe we should invite a specialist on dry eyes on a coming webinar. So no further questions. I would like to thank Dr. Brand again for his time, for his availability, for the presentation, and for answering to our questions. Katie, would you like to add something?
Yes, there is one attendee, Mrs. Wuthereis Xanthan. No,
Yes.
Nuria, do you want to allow her to speak?
She wants to make a question live.
Yeah, I think so. Yes, I think so.
Can you do this?
Yes, let me allow her to take. Okay, Mrs. Nuria
Gomez, Velasco Gomez.
Yes, Mrs. Nuria Velasco Gomez, the floor is yours. Can you open the microphone, please?
Miss Nuria Velasco Gomez, would you like to make a question live?
Please unmute yourself.
We cannot hear you. You are still muted. Oh, she says she doesn't want to ask questions in the chat box.
Okay.
Sorry for this, but there's a last question in the, and I'm not sure if Dr. Brandes, it's a comment, not a question. Someone in the audience lost all her teeth to Sjogren's and now has 8 implants bearing 24 teeth, my best 5 years. So it's a positive experience.
I'm very pleased that
with implants, and it's
that
very
Mrs.
very
Albers,
nice.
It supports my comment that implants are an option, a treatment option in patients with Sjogren's syndrome, and I'm very pleased to read this, Ms. Albers, that you have these very positive effects.
Thank you again for your time, for your presentation. Thank you everyone in the audience for sticking with us from so many different countries and different parts of the world. Thank you, Joyce, for presenting. Thank you, Kathy, for all the technical support. And hope to see you all very soon in a coming webinar. Have a great week ahead and stay healthy, take care of yourself because COVID is still around. Thank you. Joyce, would you like to add anything?
No, I think in the comments we read a lot of thanks from the audience. So I agree. Thank you, Henk, for this interesting presentation, and thanks to Katie and Anna.
My pleasure.
And I think, Katie, this will be available shortly on our YouTube channel, right? For those
Yes.
who could not attend today.
Yes, in about 1 month and less than 1 month.
Okay, thank you so much. Have a great week, everyone. Thank you so much
Thank
for
you.
everything.
Bye-bye.
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 Bye.